Hello, I'm Dr. Rebekah Bernard, the incoming president of the Collier County Medical Society, and we're presenting this webinar information about addressing some of the emotional aspects that have to do with the coronavirus pandemic. I'm being joined today by Dr. Steve Cohen. He is with the Center for Psychology, and he is one of the psychologists that is the liaison for the Physician Wellness Program that we have. Steve, thank you for joining us.
Sure. Glad I could be here.
I'd like to just jump right in and just talk about some of the anxieties and concerns and problems that doctors are facing that are unique to us in this pandemic. First of all, what are the things that you're hearing from a lot of the people that you're working with?
There's been a lot of specific concerns. I think the biggest one that I've come across is concerns about infecting their family members at home and their own anxiety about catching it themselves, but it seems to be more so just going home, being around their spouse, their children, and their own fears of giving it to them, and then the family's fears of contracting it or of something happening to their parent.
Yeah, I'm actually hearing that a lot. Right now, I've written down on a piece of paper some comments that I've gotten from Facebook from physicians, and what they're saying here is that that's one of their biggest concerns is how do they keep themselves and their family members safe? For example, I have one physician that wrote, "I think if my asthmatic husband gets this from me, I'm going to be destroyed." So what kind of advice do you give to physicians? How should we be thinking about things, and what can we do to help ourselves with this?
Sure. Well, obviously following as many safety protocols as you can is important. But like anything, there's no guarantee whether you're going to come into contact with someone or inadvertently contract this. That's not necessarily different than any normal day. The difference is we're not prepared for this, and we're caught off guard, and anxiety is contagious. So it's sort of spreading and people respond to it in different ways. When our greatest fear is unintentionally doing something that's going to affect a loved one and giving them some illness or disease that we're going to blame ourselves for passing on to them is something that would be just devastating to live with. Doing what you can to stay clean, safe is important. But so is intimacy. So is having a degree of contact with that person. We don't want to stop living our lives completely. And what is happening is a lot of physicians are going home and showering, changing their clothes. They're doing everything they can to prevent any cross-contamination type things. However, they're also sitting in the same room as their spouse, but because they're focused on keeping distance stuff, there's zero intimacy. So irritability builds and the anxiety builds because they feel this constant discomfort. We're denying ourselves some of our normal basic needs. And some of that means being close to the people in your life as you can. If you shower and change your clothes and you're clean, if you're in the same room with them, they're just as likely to get it from you as if you're being intimate with that person. So let yourself be close. Discuss that with your spouse, but maintain that relationship. Don't put extra pressure on it by trying to be distant and separate.
Okay.
Some parents, for example, some divorced parents are having their children stay at their exes because they're so concerned about their child getting it. The problem with this is, that might keep their children safe, but there's no guarantee that the other parent is going to be completely isolated and separate, because it's not just medical workers that are at risk. You have people that work at Publix, people that work at grocery stores or any of that. Their delivery people are in risk in their own ways. So we still have to look at the bigger picture and our role in that. if you're working directly with infected patients with COVID-19, yes, you're at a higher risk because you're directly exposed. But you're also monitoring your own health. And there is no guarantee. You need to continue to allow yourself to be with the family. You need to allow your family to live their life as well. So yes, social distancing is important, but getting outside is important. Being with nature, even if it means sitting in your driveway. Many of the patients I've worked with have been going to work in the hospital and then going home and staying locked in their home because they're afraid that something might occur. And the thing I'm encouraging them to do is get outside, breathe some fresh air, get some daylight.
That's one of the nice things that I've seen in my community is a lot of people doing things outdoors as a family, a lot of bike riding and throwing, baseball around. So that's something that families really should do as much as they possibly can, I would imagine, for their emotional health.
Absolutely. They still need to have structure. They still need to have a routine, a schedule, beginning and end times for activities. That's something that a lot of families, especially with school-age kids, have stopped doing. The kids are staying up super late and they're sleeping in during the morning, which is fine, but there isn't any set time that they're going to start on their assignments, their homework, schoolwork, or finish. So it's just this looming thing, and they're procrastinating and putting off, and then they get in arguments with their parents about it. So it is important to maintain structure, schedules, getting exercise, getting activities. Just because you can't go to a gym doesn't mean you can't get exercise. We need to acclimate. We need to just adjust to the situation and find ways to incorporate those into our life.
You mentioned children, and that's definitely something that a lot of doctors that have kids are really worried about. Some of the questions that I received from doctors were, I would love advice on helping my children cope. I have 3 children, preschool, elementary, and middle school. I'm a frontliner in the emergency room. My anxiety-prone middle child is having more meltdowns. And my husband and I are trying not to discuss COVID things in front of the kids, which they think has been helpful. But what else can they do? Or is that even a good idea to avoid talking about the virus? What's the best thing that parents can do to help their kids?
Great question. It's several things. One, it is okay to talk to them about it, but not obsessively or excessively. And we have to remember that even if we're not talking to them about it, a lot of times people are leaving the news on in the background while they're doing other things. And it's just repeating things over and over and over. And that can be damaging over time. And we know that specifically from previous traumatic events that occur when we're continually exposed to watching the same thing over and over or listening to the same thing. It causes unnecessary tension, distress, difficulty with sleep. So
we should turn the TV off, is what you're saying.
Yeah. And it's okay to watch movies. It's okay to watch the news, but not excessively.
Okay.
Get outside. Engage in some family activities if you need to. Just because we have this doesn't mean we have to be isolated within our home. And being there for the children is important. Answering their questions. Don't ignore them. So if they do ask a question, answer it. A lot of times parents will feel like it's too much for them to handle, so they won't answer it. So then the kids are going to go on the internet and find it some other way or ask somebody else. At least you know what information they have if you're answering the questions. Don't tell them a definitive response if there isn't one. So don't lie to them. Be honest about that. Say, this is what we think right now, or this is what we know. We don't know about this. One of the harder things that everyone's having a hard time dealing with is control, and we're focusing a lot on trying to control those things that we can't and ignoring controlling the things we can. And you can control what activities you're engaging in throughout the day. You cannot control what everyone else is doing at this particular moment. Exercise is important. So having the kids engage in some physical activity, and engaging in, one of the things I'm encouraging is engaging in mindfulness type activities. And there are fortunately a lot of really good apps that you can use that help with these. Apps like Calm, Headspace, Healthy Minds, things that just help deal with stress and find a sense of calm and purpose.
And I think that Headspace app is free for medical professionals through the end of the year.
For physicians, it is. Calm had that, but I think that expired. But Healthy Minds is another free one that came out just for dealing with this pandemic. So,
is there a simple technique that a parent could use if their child was experiencing, like, let's say a panic attack, like at the moment? Because I had a patient that told me that yesterday, that her child is actually having panic attacks. What could a parent do in the moment? Is there a particular
Sure.
mindfulness technique they could try?
Sure. There's a couple of things. First, quite often what people call a panic attack isn't. And I just want to differentiate that. So, we have anxiety and we have anxiety attacks, and a panic attack is a brief, extreme level of anxiety where it's overwhelming. So it'll last 5, maybe 10 minutes. There are times when kids have what I would just call a freak out moment. That doesn't necessarily mean they're having a panic attack. But if it is a true panic attack, that means their cortisol levels are up. Adrenaline is flooding their body. So trying to calm down in that moment is impossible. So my advice is, don't fight it. Stand up. If their child is having it, tell them to stand up and do jumping jacks or run in place. Do something to burn off that excess adrenaline and cortisol and use it instead of trying to just simply make it go away, because it won't.
Right. It has to run its course is what you're saying.
Yeah.
They have to get that energy out.
Yeah. And it'll happen almost instantly if you use it.
So just tell them to, let's do jumping jacks right now together. Let's do
Right.
it. And that might be enough to kind of break that cycle.
Yeah. I had a woman in my office that had a history of panic attacks, and she was probably 74, older. In my office, she started having a major panic attack, and she started even saying out loud, "Oh my God, I think I'm going to die. I think I'm going to die." And I said to her, "Okay, you know what? Stand up, start jogging in place." And because she was so compliant, she did. And she's jogging in place. She goes, "I think I'm going to die. I think I'm going to die. I think I'm going to die." And after it's probably 10 seconds, she sat down, took a big exhale, and was like, "What just happened?" Because she felt better.
Wow. So it takes more energy to fight it than actually kind of work with it and work through that,
Right.
Those feelings.
When we're fighting it, we're fighting against our body's natural reaction. And our body is oftentimes giving us what we need. We just have to figure out how to use it. If it's a panic attack, it's just a burst of it. And oftentimes the panic, a lot of people have panic attacks because they're afraid they're going to have a panic attack.
Right.
There's the anticipation. So you still work yourself up to be prepared, but then we try to make that feeling go away, and we assume it's bad because it doesn't always feel good. But use it. It's a burst of energy.
Can we also use that information to help our patients? Because I think one of the things doctors are facing right now is we're getting overwhelmed and bombarded with patients that are worried and anxious. And what kind of advice would you give us to share with our patients to help kind of diffuse them and give them a little more peace in their mind?
Sure. And that's, yes, the same advice is, if you're getting worked up or anxious, the thoughts are one aspect of it, but your body's reaction is another. So if your body's giving you all this tension, let's say, it's your body's way of saying, here's some energy, go use it, get things done. If you're ruminating on trying to make that feeling go away or on what negatives could happen, give yourself the opportunity to think about what positives could happen as well. So just balance it out. Yes.
Is that something we should do I'm really bad about that. I'm a ruminator and I get those repetitive thoughts. What's the best way to kind of break that cycle? I know that you say, give yourself something positive. Is that something that we should be doing, like writing it down, write down the negative thought, or what's a way to kind of help put a stop to that?
Sure. Absolutely. You can. But I guess there's sort of different techniques. So one approach is you can write down the negative thought over and over. And you write down the negative thought, and then you rate how your anxiety level. And then you write the negative thought and you rate your anxiety level. And you keep yourself in that heightened state until you can think the thought and you don't have that same level of anxiety. That can be tricky, and therapeutically, I use that quite often, but I usually prep people quite a bit before I would just say do that. It's called habituation. But the other aspect is write down the negative thought and then write down an alternative belief, a more positive, realistic thought. So yes, I might fall down, but I also might be okay. And the key to that is practice thinking that positive thought, not just the thought itself, but the emotional experience of that thought, because that's what you're doing with the negative thought. You don't just think the thought, you experience it physically. So have that with a positive thought too.
So take the person that's afraid, the doctor who said she was afraid she's going to give the virus to her husband, and she keeps thinking that thought, she should think deliberately, I'm not going to give my husband any infection. He's going to be just fine. We're all fine. Just kind of have a more positive mindset.
Yeah. So if she has the thought, I'm so worried I'm going to give my husband this infection or this disease, virus. Also have the thought of, you know what, I may pass this on to him, but I also may not. I might not be infected and I'll not be a carrier, and we might have a great time and enjoy each other's company.
Or you might give it to him and he might just be perfectly fine and not get extremely sick, because I think the reality is that most people are not dying of coronavirus. Most people are not getting extremely sick with some people are, and that's true. But, I know that you've talked to me in the past about doing that logical challenging of a belief where you ask yourself, is there facts to what I'm believing? Is it when I think I'm going to give my husband a virus and he's going to die, do I have any proof that that's going to happen? Is that a reasonable expectation? There's
usually three kind of questions that I'll have you ask. So you have this, what I would call an intrusive thought, this thought that intrudes on your ability to think about anything else. So is it rational or not? So first question is this belief based on fact? Second is, does thinking this way help me feel the way I want to feel? And the third is, does thinking this way help me accomplish my goals? Now that requires you to understand what your specific goals are in that moment. But if the answer to those questions is no to any one of those, then that suggests it's an irrational belief. And if it's an irrational belief, then you're going to kind of make a conscious choice to not think that way any longer. So first, acknowledge the thought that you're having. All right, I'm worried that I'm going to pass this on, even though I have no symptoms and I've been tested 3 times and found, so that's.
But and that's really important, because you've told me this before, that we really have to acknowledge our emotions, and even just putting the name of it, just giving it a label, often decreases the intensity of the emotion, right?
Yeah, it makes it tangible in a way, and gives it some sense of purpose. So when we label it, when we identify the feeling we're having and the thought we're having, we also allow us to experience it and then move on and come up with this alternate belief. It's that constant trying to avoid thinking something where it keeps seeping in throughout the day.
It kind of reminds me, it just made me think of like when kids are like throwing a tantrum, the little ones, and you tell them, use your words. And like, there's something about like taking that actual emotion and giving it a name. And that does have like a diffusing of ability, doesn't it?
Yeah. Like, I know you're really angry right now and you're upset and you feel like all I'm doing is attacking you right now. Boom. They're like, whoa, what? And then I understand your anger, but you need to use your words, and then they can.
Right. So we have to remind ourselves, give ourselves permission. We're feeling all these intense emotions, and we need to use our words and at least say, this is how I'm feeling, and it's okay that I'm having these thoughts. And then that helps us to be able to move on.
Exactly.
Great. I think that's really helpful. Just a little bit more on kids. One of the big things that I'm hearing is that children are worrying about their parents dying, about their parents not coming home. So somebody wrote to me and said that when she leaves to go to the hospital, the kids say, Mom, are you going to work? Oh, are you going to come home? Please stay safe. And that gets her worried and anxious. And the kids are talking about Mommy and Daddy, dying. So what can we do to help kids with that in our own self?
Right. Well, first is talk to the kids about it. Don't ignore it. let them tell you what they're afraid of, their concerns. If they're afraid you're going to work and dying, don't immediately jump in and try to tell them, I'll be fine, don't worry about it, because that doesn't work.
Okay.
Acknowledge their fears, because that's what they believe in that moment.
So how would you do that? So it said, Mommy, are you going to die? What do
honey,
you,
I know
how do
you're
you
really
address
concerned and you're afraid that I'm going to go to work and die. And I appreciate you letting me know that.
that? Okay. So that they feel heard and validated.
Yes. That is
that's really
more
the key.
important than anything else you do. That's even more important than just giving them valid data that shows why you're not going to die, because they can't hear that.
Practice it again. How do you, so the kid says, I'm trying to find if somebody has something, but what would be something a kid might say to you? Like, what happens if you don't come home from work?
So, I know you're really worried that I'm not going to come home from work. And
so you just repeat back what they said.
You validate it and validate not just what they said, but the emotion behind it. Which
you're worried that something is going to happen to me.
Yes. And you may need to pull a little bit by doing this, but you're letting them know you understand how they're feeling in that moment.
Right.
You're not telling them that they're right or that you agree with them. That doesn't matter. Right. You're simply validating their emotional state. If they keep repeating themselves and you're doing this, that means you're missing it.
Okay.
So people will, if you don't let people know that you understand in a way that makes them feel like you do, they'll keep saying it over and over and over.
So I know you've told me in the past that this is also a good technique when you're dealing with a person that's very emotional, in a high emotional state. You try to guess what their feeling is. Like, it sounds like you're very worried. Am I right? And that way, then they can tell you, no, it's not that I'm worried. It's that I'm, right. Whatever other emotion.
Or they'll validate it by saying, the goal is to get them to say yes.
Right.
So that you form this kind of
But if they keep repeating it, then obviously you might not be getting the right emotion that they're feeling, like you're not connecting.
Absolutely. And especially with little kids, they're not always good about putting words behind how they're really feeling. So they'll say they're mad when they're really scared and so you have to be intuitive that way. Okay. And just know that if they're repeating yourselves, you're missing whatever they're trying to express. So think about it from their point of view, not your own.
Got it. Yeah, I think that's hard to remember what it's like to feel that way.
It is.
To be a child and vulnerable.
And the same thing goes with adults. It's really no different. It's just typically adults are better at expressing emotion.
Right.
But not always.
Not always. Not always. Well, I think that's really, really helpful. The other feedback that I'm getting from doctors is dealing with stressors when it comes to their employer. So I'm hearing from a lot of doctors that have felt, not so much in our community, although there may be some of this, doctors that feel that maybe they're not being as well protected as far as the correct amount of protective equipment, or that they feel that their organization hasn't been as receptive to getting them on telehealth and has put them in harm's way by having them see patients because of profits and whatnot. Sure. And a lot of doctors are feeling some anger and some discontent. What kind of advice would you give to doctors that are feeling those emotions?
Well, and it's tricky because every situation is going to be a little unique, but some of that is being fostered by this sense of detachment from others, and feeling like they can't voice their concerns. And the problem is sometimes when we do voice the concerns, we do it in a sort of an unhealthy way. We do it in just a way to sort of complain, bitch and moan without any real option for a solution. So we're saying, we're mad because you're just doing this and this and this to us. Not, hey, this is really concerning me. Maybe if we could do X, Y, and Z, that would help. So offer the employers, if they feel like their employer isn't hearing them or isn't protecting them, let the employer know that by saying, this is how I'm feeling about this, and this is what I would like. This is what I think would help. Give them some option. But give the employer an opportunity to say, you're right. I didn't think of it that way. Instead of just going in on the attack. That always makes everyone defensive, and then people start fighting for things for the sake of fighting as opposed to what's right or what's
trying to solve problems. Do you think that this is another example where we really need to talk to our peers and our colleagues, and which is really hard right now with the pandemic, because it's not like we can have our socials and our get-togethers. You know, a lot of what we're doing now is more, I guess, online and virtual. But what is the role for us in working with our colleagues and our friends when we're feeling these emotions?
Well, and I think it's important, to still have some contact like we're doing right now, where it's over some virtual platform. It's not ideal, but it's better than complete isolation. And talking about it with others, not just complaining, but venting or voicing it, but then giving the other person a chance to validate it and for them to vent to us also. It has to be mutual.
And because that way we don't feel like we're totally alone, because I think sometimes you do start to kind of withdraw into yourself and you start to think like you're the only person that this is happening to. And if you talk to someone else, you realize we're kind of together.
Right. And we start thinking in extremes, and people respond to stress or trauma in very different ways. And I always, the example I always think of is if you have a person drowning. So let's say there's somebody in a lake with a bunch of people around and they start drowning. You have the one person that's going to run toward them to try to save them. You have the other person that's going to freeze up and scream and yell for help. And then you have a third person that's going to get in the way of the person that's running to try to help the person. And we never know how people are going to truly respond until they're in a situation that this crisis mode. And right now, the world is in this crisis mode, and
Yes.
everyone feels off because nothing is normal.
It's so true. And I think we're feeling that. And how can we not?
Right. I mean, I'm reading a book and somebody hugs another person and my immediate thought is, oh, you can't do that. And I'm like, it's a book.
But yeah, we're off our routine, we're off our game, and then we're feeling all these emotions from all these other people, and it's really unsettling.
Right. So being aware of that everyone is feeling off, we're not isolating that. And people cope and deal with that in different ways. Some deal with it by trying to rush in and make things better. Others ignore it, freeze up, or just pretend it's not there. And then others will rebel. Others will fight and get angry because they don't know what else to do.
Right. So we kind of have to give ourselves a break because we really don't know until we're in the moment how we're going to respond.
Right. And if somebody is responding in a way that you don't expect them to or can't understand, don't jump and judge them for that. Look at it from their perspective and think they may have their reasons for doing it, and it might not be because they're mean or awful or ignorant. It might simply be they're in a crisis moment.
We have to kind of watch our own sensitivities. And I know for me too, like sometimes, you say something and someone snaps at you and you take it personally, but meanwhile, it may have nothing to do with you. It's that person's state of mind at the time. So I guess we need to give our colleagues and our friends a little bit and our patients a little bit more leeway during this difficult time.
Absolutely.
When you were talking about how you respond in a crisis, it made me think of the really sad situation in which we lost an emergency room physician in New York who reportedly took her life and told her father that she was just really overwhelmed with the amount of death. And this is an ER doctor who is somewhat used to dealing with life and death, but the intensity of it, I guess, was just perhaps, we don't know all the situation, but right. It sounds like it was really overwhelming. And I know that you've spoken to me about how sometimes a person without any real underlying mental health conditions can sometimes get like pushed into this state of hopelessness and despair by a really traumatic situation like what we're seeing right now. I worry about people that are on the front line. What should they be doing if they're starting to feel overwhelmed by the intensity of these emotions and death and how it's impacting people?
I think number one, reach out, get support, call a psychologist, a counselor, get some help in that area. You don't have to be doing this on your own. In addition to that, you have these people on the front lines that are very empathic and passionate about what they do. And when you're exposed to death a lot and just constant trauma ongoing, you start to internalize that and you start to experience what everyone around you is is going through. And that's oftentimes what can lead to them crossing over into that hopeless despair mode. And it can happen somewhat quickly.
Right.
Get help preventatively. Don't wait until you're feeling overwhelmed. Talk to someone beforehand. That's my number one biggest.
It kind of makes me think of like debriefing. Like if you're in like a military operation or a police operation and somebody gets shot, don't people always have to go and do some kind of like debriefing where they talk about it and kind of discuss the situation, and maybe they even go talk to a
Yep.
professional if it was particularly intense? But yet in medical field and as physicians, you know, we just a patient dies and you just move on, and there's really no debriefing. It
Right.
seems like that might be something, especially now, that we need to incorporate more into our profession.
Absolutely. You know, and one of the concerns I have is after this passes a little bit, several months down the road, is when we're going to really start to see a lot of the damage, the emotional trauma, the PTSD, that's where I feel like the mental health aspect of things is going to become somewhat overburdened, because that's when people typically start to respond. Not when they're in the crisis, when it slows down and they have a moment to breathe again, it overwhelms them.
Like right now, we're kind of in adrenaline mode, and then when it all wears off, it's like some of us are going to be maybe, you know, find ourselves in a dark spot, or, you know, reliving those feelings. So how should we prepare for that, and what should we be thinking about? Because we know we're going to see patients, even like people that have recovered from COVID. I'm understanding that a lot of them are dealing with PTSD and emotional trauma. And so what should we do to prepare?
Well, and a lot of that is where the mindfulness kind of stuff comes in, because the mindfulness-based practice is sort of, you know, meditative, or focusing on just being present and in and now. And it doesn't help immediately. It's practicing it continuously. We start to get the benefits. It can take like 6 to 8 weeks even before you really start to get the benefits of like 5 to 10 minutes of practice a day. So starting that now, the idea is it will be helpful when you're at the stage where you're really going to need to benefit from that, because that's what can help with the emotional resiliency and self-awareness.
So is that something we should be, of course, doing for ourselves, but also recommending to our patients? And what is the minimum that a person really should try to do? Like, what's the easiest way
You know,
to
and
get there?
the tricky part is I don't really have a good answer for that. You know, the research has showed about 5 to 10 minutes a day. It takes about 6 to 8 weeks, and we benefit more from a guided type meditation than just doing it on our own. But doing it on our own is fine. But not all meditation is the same either. You know, the biggest thing is focusing on breathing. The easiest way is just somebody taking a couple minutes to just try to focus on their breath. The problem is people aren't good at this. Our mind wanders, and we get discouraged because we think we should be great at it. But that's the whole point, is you're not going to be good at it. Accept that. And in fact, if you are good at it, then you're probably not doing it right. It's doing it even though you're not good at it, and not quitting on it is where we really start to get that benefit.
Okay. And so you say guided meditation. So again, these are like your apps where, you know,
Calm, Headspace.
The body scan thing where they're like, okay, imagine your head, and now your nose, your jaw kind of moves down through your body, and you breathe through it.
Yeah, and there's tons of different versions, and again, there's hundreds of different mindfulness exercises out there. At a basic level, the goal is just being in the moment and just focusing on a single thought, idea, concept, emotional state, as opposed to trying to avoid that, and letting yourself just exist in that moment in time.
Is that something, should we do that in the morning when we first get up, at night, in the middle of the day? What's the best way for a doctor to structure that?
Well, to start, I usually recommend picking a time to do it, just to develop a habit. But it doesn't matter if it's the morning, at night, in the middle of the day. You can do it all three. You can do it whenever, but scheduling it, structuring it in the beginning helps.
I'm looking to see what other questions some of the other physicians have written to me about. Um, I think the biggest thing that I'm seeing here is just frustration and just dealing with a new world. So the keys from what I'm hearing from you, uh, structure and routine, practicing mindfulness, and maybe giving ourselves a break, realizing that we're all in this together and this is sort of a new world, and we just have to give ourselves a little slack sometimes.
Yeah, and well, and exercise and maintaining a sense of purpose. The purpose isn't just to prevent people from getting this. The purpose is internal for each of us, and it's different. It's doing our job or helping people, or it's managing our children or our family, making sure people are safe, and structuring our day so that we still feel like there's a reason to get out of bed.
And that might be hard for some, like if a doctor right now is furloughed, or their practice isn't that busy because people are still scared to come out. I think that, so many of us physicians our work is kind of our life. And so right now, some of us haven't, like especially surgeons and people that do the type of work that's been on hold, maybe are feeling a little bit like their purpose isn't quite there. What can they do while things are ramping back up?
Well, and a big part of that is adapting, and as best you can, as far as, telehealth or finding other safety measures to keep engaged, but trying, instead of fighting for what we're used to, creating, adapting to the new culture, because this isn't just going to disappear tomorrow.
Right.
It's going to linger, and it's going to change the way we do everything in many ways. And we're often very resistant to any type of change. I myself has been so resistant to doing teletherapy, kind of telehealth type things, and I still don't love it. But that's it's all I've been doing now for the last couple months or month or so. So I'm getting used to it. And is it ideal for me? No, but I used to fight it. Where now I'm saying, all right, you know what? I've got to make the best of this. So I'm trying to accommodate it as best I can to make it as functional and progressive as I can.
Yeah, I was really resistant with the web visits, but I've actually found it to be not as bad as I thought. And it's also kind of fun in a way because I get a little peek into people's lives sometimes if they're on a web chat with me and they're on their lanai and they show me their dog or their cat. And so there are certain elements that are almost a little bit fun. And now that I'm bringing patients back into the office and I have to wear a mask and have them wear a mask, I almost kind of miss the video so I could actually see somebody's face entirely.
Right.
So it's kind of, you said, we resist change, but then sometimes once we try the change, we find that it's actually pretty good and we like it. Like I can see myself incorporating web visits much more into my practice than I ever did previous to this.
Right. And it's going into it with the attitude of, all right, this is the way it's going to be. So how can I make the most out of this instead of just fighting it the entire time?
Right. I have one last topic that I'd like to bring up for you before we wrap up. And that is, I'm hearing from physicians, particularly those of Asian background or who have Asian appearance, that they are facing a lot of negativity from the public. So, super inappropriate behaviors and people saying, you caused the virus, you're from China, and horrible things like that. What advice and what can doctors that are facing this type of experience, what can they do to help the situation?
Yeah, and it's not so different than what happened in World War II, to Japan and World War II with Japanese Americans. It's people want something they can latch onto and a reason, and they displace their emotions essentially. So they're angry at, let's say, the Chinese government, so they're taking that out on what they can because they can't yell at the government or they can't yell. So they find some target, and it's not healthy and it's inappropriate in many, many ways. But if you have someone that's telling you how angry they are at their neighbor because they're from China, don't immediately jump into arguing with them. Same thing I was saying before, give them the opportunity to express themselves. Let them know you understand how they're feeling, and then you can go to help try to get them to look at it differently. Because most of the time, they're not really angry at that person. They're just focusing on that as something concrete that they can take their feelings out on.
Mhm. Yes, I know in the past that you've talked to me, given advice for, like, say, women physicians that are facing sexism, that one helpful tool is to sometimes just repeat back what the person has said so that they can kind of hear it in their own ears. So like physicians, I've heard stories of doctors, like an Asian doctor who was treating a patient and he said, I don't want to see you because you're Asian. So even repeating back, so you just said that you didn't want to see me because I'm Asian, and then you can tell them, that's not okay. But even if you just repeat back their words, sometimes having them hear it in their own ears will sometimes help the situation.
Absolutely. People aren't always aware of what they're saying when they're saying it. So when you repeat it back to them in a way they can hear it, it often makes them pause and just kind of consider what was just said.
And you've said to me in the past that one of the keys is when, even though you're feeling very angry, when you're hearing somebody say something to you that's so wrong and so inappropriate, it's really important to just stay super calm. I guess it's kind of like how you are with a kid. When you're really angry with a child, you don't, hopefully you don't, just yell at them. You want to stay very calm and say, what you've said is not right and this is not okay.
Yeah,
to get better results.
You have to stay in control of yourself if you're trying to control somebody else. So
that's good.
If you're yelling and screaming, you're out of control. So how are you going to get them under control if you're not? So part of that is, when somebody's saying these inappropriate things or yelling and screaming at you, is to ask in your own head, what is going on with them that they're acting this way right now?
Right. But on the other hand, we don't want to ignore their behavior. We want to, we can call it out, but in a calm way, and, trying to show some empathy to where they're coming from, but making it clear that, that kind of behavior is not okay.
Right. Don't attack back, because you're just
It's hard though. It's hard because I'm sure you get emotional and it's very upsetting. So it's going to require, quite a lot of self-control to be able to do that. I know in the past you told me one of the things that we can do is practice, how are you going to feel when someone is antagonistic towards you? Practice the feeling of feeling calm and responding in a controlled manner.
Yeah, visualize it, imagine it, but in the emotional state also. Don't just picture it like you're watching a movie, picture it like you're living that moment. And that way you're not caught off guard and you believe that you can stay in control.
Right, not all of us are going to experience, hopefully racism and sexism, but we're all going to experience a patient that's in a high emotional state, or a lot of the conspiracy theories right now, like, for example, I had a patient, I asked her to wear a mask and I was wearing a mask, and, she got upset about that because she's read that, the masks are actually going to make this worse. And so I think we're all doctors are facing at least a little bit of those kind of highly emotional situations that can be directed at medical professionals. So using those same kind of techniques where you just, try to find out where they're coming from and validate their emotions as much as you can, but then also give them in a calm and clear way the facts and the truth of the situation.
Precisely.
Not easy to do. Easier said than done, but practice. Well, I want to...
You get better, so...
Yes, I want to thank everyone for joining us. Dr. Steve Cohen is the psychologist with our Physician Wellness Program. He is available for members of the Medical Society as well as to all community physicians during the pandemic and Alliance members as well. You can go to the Collier County Medical Society website to find out information on how to contact him for an appointment. Our members and others are going to receive 6 sessions per year, completely free and completely confidential and anonymous. You do not have to worry about any sessions getting out in the public or following you or affecting your medical license or anything like that. So please reach out. And if you have any other burning questions that you would like us to address in a future webinar, please send those to the Medical Society. And if you would like, we can do another session and answer your questions. Thank you so much.
Thank you.